everyone, and thank you for joining us today at our media advisory. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. Today marks our 100th episode of the COVID-19 media briefings in town halls. A ominous 100th episode. Who'd have thought we'd be still at it some year and a half later, but here we are. And as we know, the pandemic has changed our lives, and as we look toward the road of recovery, we remain committed to communicating important information to you, the public, and sharing that latest information through a variety of channels. So looking at where we are today, our individual and collective efforts to engage, share information, and support family, friends, neighbors, and local businesses have reinforced the great resiliency of Hamiltonians when we all work together. So thank you for your commitment for staying the course. And so moving into the briefing, the promise will enter step 2, the roadmap to reopen as of 12:01 a.m. on Wednesday, June the 30th, 2021. Good time to get a haircut. I'll be going to the Mario the Barber first thing Wednesday morning. Step 2 of the roadmap to reopen focuses on resuming more outdoor activities and limited indoor services with a small number of people where face coverings are worn with other restrictions in place. And Paul will speak to those restrictions, what's open, what's not open, what's available, what's not available shortly. But as eligibility to book a vaccine continues to expand, more residents will be able to receive a second dose sooner. Best way Hamiltonians can protect themselves, their loved ones, and our communities by booking their first or second dose and completing the vaccine series as soon as they can. So it's vital that members of the public, even those who have been vaccinated, ensure that public health measures are practiced until it is safe and said so by the health officials at all levels of government. These measures include staying home if you're feeling unwell, getting tested for COVID-19 if you have symptoms or have been in close contact with a confirmed positive case of COVID-19, maintaining that physical distance of at least 6 feet or 2 meters from those outside of your immediate household, and wearing a mask or face covering indoors and outdoors when not able to maintain physical distancing, as well as washing your hands frequently. Those are still measures, if you've been unvaccinated, those are still measures you need to practice to continue to keep yourself and others around you safe. In terms of the vaccination effort, it continues forward at a pretty significant pace. 520,709 doses have been administered in the city of Hamilton to date. 73% of the residents age 18 plus have received their first dose. And from that group, 32% have completed the vaccine series. So that's good news. Also good news is an estimated 57.5% of Hamilton youth ages 12 to 17 have received at least their first COVID-19 dose. And we expect that before too long, we'll start working on second doses as well. So we're continuing to go on the path of reopening. We must all do our part and receive a first and second dose to complete that vaccine series. It is really the best tool that we have to lead us to return to the things that we all want to enjoy. So for more information on that and anything having to do with vaccine bookings, go to hamilton.com/vaccine booking to book your vaccine appointment. Do it as soon as you can. As of today, everyone 18 years of age and over can book a vaccine. And I think Dr. Elizabeth will talk more about that as well. I'll now pass it over to our Emergency Operations Center Director, Paul Johnson.
Thanks very much, Mr. Mayor. And yes, a significant step being taken on Wednesday by moving into step 2 of the roadmap to reopen. And a number of things happen in terms of indoor things. So again, the mayor talked about this is really about expanding more outdoor things, but there are a few indoor things of significance for the general public that will happen on Wednesday at 12:01 in the morning. And the first is, of course, that it will be permitted to have indoor social gatherings or public events of up to 5 people. It's a very low number and would ask the community to respect that number, but up to 5 people can be indoors. But taking all the necessary public health precautions in terms of keeping distance, because these would be people not from the same household. And we want to make sure that people are still protected. The other piece, of course, is that personal care services will begin. That'll reduce capacity for those that have multiple people in at the same time, and with a number of other restrictions, including that masks must be worn at all times. And so the haircuts and other items that people have been talking about for a long time will begin, and those are in indoor places. Malls will also open again with some restrictions so that there is access to the retail establishments that are completely enclosed within the mall structure. Up until this point, if you've had an outside door, you've been able to open if you're in a mall, but the malls themselves have not been, and that will change on Wednesday as well. Won't be able to hang out in the mall. It's not a place to go and spend lots of time. There'll be a need for people just to go there, engage in the retail activities that are within the mall, and then leave. Again, this idea that indoor spaces are where the risk is greater, and the duration, the number of people, and the closeness of the contact of those indoor activities heightens that risk as well. From an outdoor perspective, more ability to have fun with people at a table at an outdoor patio setting, now up to 6 people per table. So invite a couple of more people to join you at the table if you're so inclined. There are less restrictions again on some of the outdoor activities to do with religious services. A big one is that outdoor sports that are played without contact or with very minimal contact, or can be modified to avoid contact, can happen. No restrictions on the number of people or teams participating, and in fact, some level of spectators that are able to come and enjoy that opportunity. And I'll talk a little bit more about that when it comes to city facilities in just a minute. And some exciting things that will, I think, happen over the coming days and weeks, may not happen immediately on Wednesday, but we'll see, is that we can be having some of those outdoor concerts occurring. Again, spectators limited to a 25% capacity. 25% is really the number that's occurring right now in terms of where we are in the steps. But again, those are able to be there, outdoor theaters or cinemas, and even planning for things like outdoor fairs or rural exhibitions or festivals, again at that 25% capacity. So again, not sure that those will happen right away on Wednesday, but community arts and culture folks may be anticipating that they'll think about how they can get some of that entertainment happening in our community, and whether that's on a patio separated correctly by at least 3 meters from the patron, or whether that's in some event spaces outdoors where we can enjoy concerts and other entertainment. This is some of the good news of moving into these steps, and done safely. This is going to be a great way to enjoy some things outside and get back to a little more of that normal summer activity. From a municipal service perspective, a couple of things that I want to talk about. The first is our municipal service centers and counters, which include both those at City Hall and those within our municipal service centers in a variety of the former municipalities in Hamilton. They will begin providing counter service by appointment only on July the 5th. And so for those that wish to come in person, we will start with appointment only. And then as we move through the summer, we'll open that up in terms of a walk-in component. But as of July 5th, appointments can be made at any of our municipal service centers or City Hall, and has already been happening for a little bit, our Provincial Offences Court as well. From a special event application perspective, we are now opening up the process to accept applications for events that are both in person as well as virtual. And this is a change because obviously, as I just mentioned, there are the opportunities now to do some outdoor in-person events. And so our SEAT process, as we call it here at the City of Hamilton, but the special events applications are now open. And obviously we'll prioritize those that are clearly working within the parameters that exist now. But as people are anticipating things happening later in the summer, we'll take those applications and work through them as quickly as we can. Recognizing that we spend a lot more days on these things than 1 or 2, but we'll try and turn around applications as quick as is possible. The last piece is we have not yet determined exactly how the limits we'll put on spectators for our recreational fields at the City of Hamilton. We have about 300 sports fields at the City of Hamilton, and we're trying to come up with a formula that works. It is 25% capacity for spectators, but of course, most of our facilities don't have any stands, or seats, which are easy to quantify. It's just an open space around the fields. And then you add the complexity of sometimes for our younger members who are are out playing, particularly soccer, we sometimes split the field widthwise, and then you can have many more people playing, but also many more people potentially wanting to watch. So tomorrow we're going to make some decisions in terms of how we'll calculate that so that the leagues have something they can work with that's easy for them to administer, because there are some requirements on the leagues to take contact information, but also to ensure that we're setting people up for a safe way to watch some of the activities outdoors as we get into that outdoor sports activity. So that will come, and we will publicize that not only to our user groups and sports programs, but publicly as well. Lots of things begin this week and next within recreation, including the opening of some outdoor pools in the Dundas wading pool this week. And then our other wading pools and our Camp Kadaka and Soupy programs will begin next Monday. We have modified these programs a bit, and we've also offered some opportunities that if people don't feel that they want to be part of the group activities, there can be some self-directed activities through recreation that families may choose to do on their own within the parks, getting out and enjoying recreation by doing some activities planned by some professionals who have great ideas about how we can have fun outdoors for those who just don't feel that the group setting is right for them. And all of that information and all of the times and the locations can be found at the city website. The best place to go if you want to go right to the recreation page is hamilton.ca/recreation. For those who have been taking advantage of the free emergency childcare for essential workers, a reminder that that ends this week. In fact, it ends tomorrow on June the 29th to coincide with the last day of school. The three agencies, the licensed home childcare agencies that have been providing emergency childcare, are working through transition plans with the families who are currently using that service. And I really want to extend a thank you to those three licensed home childcare agencies who have just done incredible work providing emergency childcare at a number of times throughout this pandemic, and has been a great support, and it's allowed us to offer emergency childcare not at 2 or 3 large sites, but scattered throughout the community, which has been better for people who need it. From an enforcement perspective, as I mentioned the last couple of weeks, it maintains itself that the vast majority of our enforcement right now is things that have absolutely nothing to do with the pandemic. It is really about people being outside and getting themselves into off paths or into areas where they're not supposed to be, and as a result, having some charges laid against them. There were a couple businesses that did have some penalty offenses notices, one for opening when early, which was that personal care service area opening early. That can't happen until Wednesday. And then some for a restaurant cause and effect. And again, it's a reminder that, yeah, it's great to be out on the patios. Yes, it's wonderful that we can enjoy some of these things, but we need to do it safely. There are areas where you're required to wear masks. And obviously, as a proprietor of these businesses, your staff need to be well-trained in terms of the mask wearing when they need to do it and how they need to protect the patrons who are coming. So all of that needs to be adhered to by businesses. I know there's great enthusiasm to get things open, but we need to do it safely. A reminder that fireworks, though permitted from a private perspective, use them safely. And there's lots of tips on our website about fireworks safety. And again, the City of Hamilton not running any large-scale fireworks shows, and no anticipation that that's going to happen through the summer. But certainly there have been lots of private families and gatherings that have been enjoying fireworks. And just to pick up on the last piece that the mayor mentioned earlier, the 100th episode, we all remember the first time we were standing there in City Hall, and we were actually in the council chambers for the first. And yeah, I don't think we would have said it's going to get to 100. We knew there'd be more than one, but we didn't think it would get to 100. And I do want to thank the mayor and Dr. Richardson, who, the three of us have been doing this for a while now, Bill Custers and his team, Georgia and Rosalie, who remember provided ASL interpretation early on and were there for a number of these episodes before we went to another system of closed captioning. And I do want to say thank you. I know that We've heard a lot through this period from Jasmine Graham, who's been taking us through most of these over the time, but there are a number of communications people here at the city that support us in making sure that we have good information and doing the follow-up afterwards with the media when inevitably we get asked a question or we don't have the information that we need for our media partners. And so for all the work that they do each and every day to keep us communicating well, I want to thank them on behalf of all of the city team as well. So with that, over to you, Dr. Richardson.
Thanks so much, Paul, and a great note to join in on in terms of the thanks. And it is pretty incredible that we're here at the 100th episode. Many, many thanks as well to you and the mayor for these sessions, and to Bill Custers and the team at Cable 14, the comms folks, Jazz, and our crew back in Public Health Services, Ashling and Jack and James, who've been working on this, and all the staff that have been providing the information, the data, the epidemiology work that is done by all of our epidemiologists. See, even I have a hard time saying it some days, Mr. Mayor. It's just been fabulous, and so grateful to them all for giving us the information that we have. And so I'll launch into it today with our COVID case activity, which is very much continuing on that downward trend. We're at 21,248 cases, a net change though of just 12 cases from yesterday. And now our local activity is mirroring that seen back in October of 2020. So very, very good news. This is exactly what we wanted to see the case counts come down, see the hospitalizations and deaths be at low levels. And that is what we're seeing. And hopefully we have a number of people who are still in ICUs, of course, here in Hamilton, but we're very much looking forward to them getting better and moving forward as well with our other surgeries and things that require those hospital beds and those ICUs as well. Our 7-day moving average is just at 14 and the weekly incidence at 16. Our reproductive rate is at 0.97, which is up a little bit, and that's kind of just gone back and forth in that area over the last couple of months. We have just one active outbreak, no new outbreaks to report today, and our percent positivity in our test results is just at 2.2%, with Hamilton now ranking 6th out of all the health units in Ontario, according to the ICIS data. More good news as well on the vaccine front. So as you heard from the mayor earlier, we passed the 500,000 mark in terms of vaccinations administered. So over 500,000 vaccines administered at 520,709 done locally. We have 73% of our adults over the age of 18 having been vaccinated. 31.7% of people have now completed their vaccine series, and almost 58% of youth 12 to 17 have had at least one vaccine so far. We did launch a new and redesigned our vaccination status page earlier today, and that was launched for you to use. That page is now migrated over to the same Power BI tool, the same kind of dashboard that makes it better in terms of how both we communicate the data, but also easier for people in the community, people in the media to work with the data that they find on the web. So we'll be presenting it in a very interactive way. It's going to be easy to digest. You'll be able to filter, sort, toggle between different views, and all of the data that was there previously will continue to be reported on the dashboard daily, but there'll be some new data that's there as well, like number of eligible community members who have completed their vaccine series, those sorts of things. Of course, there's other good news on the vaccine front. So the announcement by the province at the end of last week about the eligibility for booking accelerated appointments for a second dose of mRNA vaccine, either Moderna or Pfizer. So for those 12 to 17, it was expanded on Saturday, and of course they're eligible for Pfizer. And this morning it moved to all community members 18 years of age and over being eligible to book their vaccine appointment. We added about 45,000 appointments onto the provincial website last week, and we did about another 8,000 today. Those have all been booked. I think I went mute there for a moment. Please do check back frequently, as we'll be adding more appointments as we go. For those that are booking their second dose, the second dose appointment does have to be scheduled at least 28 days after the first dose. That's the recommended minimum interval. Of course, we do get a surge in demand, but as I said, we will be adding more appointments as we go. So please check back frequently through our website. Remember too, you can check through the pharmacies and you can find them through the Provincial website. And as well, there are some primary care practices that are offering vaccine clinics, and you can find those on our websites as well. To ensure maximum protection against that Delta variant, it is critical that people get both their first and second doses. So we still have some 26% of Hamiltonians that haven't yet had their first dose. So very much encouraging everybody to reach out to people that they know, talk about vaccines, talk about why they got vaccinated, talk about their concerns if you haven't been vaccinated, reach out to your family doctor if you need to, or other healthcare provider, and have a chat about it. We really want to make sure that you get vaccinated and that you're protected. I think that's it for me today, Mr. Mayor. I'm going to send it back to you.
Okay, thank you, Paul. Thank you, Elizabeth. And as we know, the warm weather and the news of the province entering step 2 on Wednesday not only moves our city and businesses on the path to recovery, it also affirms that the vaccine is working. So get your vaccine and complete your vaccine series will move us closer to the next stage of reopening, and that's a good thing. So, you know, protecting yourself, your family, your friends, your community is done best by getting the vaccine. And certainly that will help local businesses begin to open up sooner rather than later. So please do your best to get out there, get your vaccine dosage. Again, today, the eligibility for anyone over 18 is wide open for you to book. And we want more and more people to get those doses in. So thank you for all of that. And before I do the thank yous and all the other great people that have put all these great events together, let me just turn it over to Jasmine again to lead us through some of the media folks that have helped us share this information on an ongoing basis in our broader community. We thank them for that. So Jasmine, if you would lead us through questions, I'd appreciate it.
Great, thank you, Mr. Mayor. We have 5 media joining us today. So as usual, we will start with 1 question and 1 follow-up for everyone. The first question will be to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Great. Hi there. Thanks for the questions. My first goes to Paul Johnson. And so the city's site was showing that Cause and Effect has been ticketed for not following COVID-19 rules again. And this has happened a couple of times. And I'm hoping you can provide some context into what happened in this scenario, but also what can be done when the same places kind of pop up on the city's radar with similar tickets.
So, you know, there's a continuing piece of investigation I can around this particular piece. And, you know, again, this is a place that's popped up before. We can take additional actions, and you've seen that happen before where, for instance, liquor licenses have been suspended for a period of time, or, I mean, there could be more dramatic pieces, but I think that what we're looking at here is continuing to make sure, A, we visit those that are in hotspots. And I get this question a lot, is that, you know, are you just targeting people, going door to door, trying to target and find something? And the answer is a lot are complaint driven. The second piece is we do those, you know, surprise or pop in inspections here and there where we see things going on. But certainly for those who have had a history, we do check back in and make sure that there is compliance around it. And again, we're not trying to be, you know, a thorn in their side, but this is, and some of these things are not new. You know, face masks must still be worn in certain cases, and they need to be worn. Some of the other pieces that are there, just, it hasn't changed much. We've been open for patio dining in the past. And what is wonderful is that the vast majority of these patios, and believe me, there are a lot of busy patios over this last period of time, they've been doing really well. So for those who choose to just, you know, not get it, or feel that this is something that is a minor inconvenience that they'll pay no attention to, the answer is we'll be there and enforcing. And if you've had enforcements before, there's a good chance that at some point we'll pop by and just to make sure that there's still the compliance there. And these are all done for a purpose. So, you know, when we're eating, we don't wear a mask. So if the music level is really high, and I get it, people like music, it's a night out, it's all that great stuff. But what happens when the music's too loud? We have to start raising our voice. What happens when we raise our voice? We know what goes on. This is not new. This is not rocket science. We're still in a position where we want people to get out and enjoy themselves. And that's the piece that I want to encourage time and time again. Get out and enjoy it, but do it safely. And for those businesses that are just choosing not to do it, one is the public are aware of these things. So there's going to be complaints lodged, I can guarantee it. And then the second piece is, we're out there to just make sure everybody's doing the right thing. So that's a bit of the, the downside of having to see the same organization listed. This is a multiple time for this business. Again, these are charges and they may fight them, and we'll see what happens at the end of them, but that's the charge that we've laid. I want to end though on the note to say, when you think about, and I know from my own friends and my family and talking to colleagues, how many people have been out enjoying patios, you see on your chart only 2 things that were listed. One organization had 3 charges against them, but only 2. One, a business that shouldn't have been open from a personal care perspective, and only one of those patios. So that tells me that, our challenge is to make sure that there's a few places that get the message and do things safely. But it also tells me that we've had just a tremendous, tremendous response from our business community doing the right stuff. And I expect that that's going to continue. And as more things can start to open, my only encouragement is do what you're supposed to do, and we'll be fine getting through this. But we'll be there to enforce as well along the way. So congratulations to the businesses that have been doing some great work over this last little period of time. And we'll have an ongoing discussion about the cause and effect as it moves forward.
And Christine, did you want a follow-up question?
Yes, thank you so much. My second question is for Dr. Richardson. And case numbers have been lower than usual, and things are, knock on wood, looking good. But I wanted to ask about, this consistent concern about the Delta variant and its contagiousness. And so how big of a problem is the Delta variant right now? And has the concern changed at all with the better than usual numbers?
Thanks very much, Christine. So the Delta variant remains an issue of concern. And so, here in Hamilton, we've been identified as a hotspot for the Delta variant, one of a number of health units in Ontario. And it is more transmissible. We're still trying to understand if it also makes people sicker. That's not fully clear yet. But if you want to see what the challenges are, we just have to turn to our neighbors in Waterloo, where they have seen their case numbers go up, seen more hospitalizations and people in ICUs. They have seen lots of outbreaks that are happening there across a range of different premises. So very much looks like where we were at several weeks ago when you looked over towards Waterloo Way. And it's been an issue right across their communities. So something to very much be mindful about. This is why getting our vaccination rates well up, our first dose vaccinations, and of course our second dose vaccinations, because it does look like Delta is better impacted by 2 doses of vaccine. So we absolutely want to get those rates up there.
Thank you, Dr. Richardson. Our next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a pleasant weekend. My questions are for Dr. Richardson. I understand that someone who received 2 doses of the COVID-19 vaccine, or one of the vaccines, has died, is reported dead. I'm just wondering how many other people who received 2 doses have died here in Hamilton, and what more you can tell us about this specific case, because I wonder how generalizable this is to people. Lots of people, including myself, have got 2 doses of the vaccine.
Yeah, thanks very much, Bobby. Very unfortunate for this individual case that we did hear about. Unfortunately, as we know, no vaccine is perfect. There are going to be at some instances where somebody who has had even both doses of the vaccine does go on to get COVID-19. Or, of course, the other thing that can happen is that something else may occur along the way in somebody that has been vaccinated. So any of those sorts of cases would need to be looked at, reviewed, decided what was happening there. And of course, that's more in the realm of the coroner and others in terms of what happens on that front. When we're thinking about it as we go forward, we do know, as I was saying earlier with the Delta variant, 2 doses of vaccine are more effective. And so that's why it is really critical as we move forward that people do get vaccinated so that they can be protected against that variant in particular, but all of the strains of COVID-19 seem to be working well with these vaccines.
And thank you for that. In terms of this case, I realize you can't tell me so much because, confidentiality and all that, but can we get a sense of just some more specifics about this individual? Because I'm just wondering, is this someone who is really old and you're much older and had, underlying health conditions, or was this or something else? It'd just be nice to know a bit more. I feel like it's a little vague.
Yeah, thanks, Bobby. Unfortunately, this is one of those situations where privacy does trump all, and I can't give you any other specific details about this case.
Okay, thanks.
Thanks, Dr. Richardson. We'll go next to Jessica Maxwell, also from CBC Hamilton. Jessica, you can go ahead.
Thank you very much. This question is for Mayor Eisenberger. Is there any concern about people gathering for fireworks in large groups on Canada Day?
Yeah, so, there are still limitations in terms of the numbers of folks gathering in groups out in the broader community. I think maybe Paul can update us on what those limitations are. There's still concern around people gathering in large numbers. There's still concern around maintaining masking and physical separation, things identified earlier in my presentation. So all of those issues still apply. That Delta variant that the doctor talked about is of concern in our broader community. And as you just heard, even folks that have been fully vaccinated are potentially could still either be a carrier of the vaccine or be compromised as a result of it. So we're not out of the in the clear yet. There's much more to do, and so there is an underlying continuing concern. I think in terms of fireworks, Paul, could you address what the regs are in terms of folks gathering together?
So the bottom line is fireworks are allowed for personal use, and so this is on personal property, and you need to adhere to the guidelines. And the guidelines are, as of Wednesday at 12:01 a.m. that up to 25 people can gather in an outdoor setting. So that would be the limit. And that is exactly why there are no large fireworks displays happening through the city. We are not permitting any large fireworks displays to happen at the city from a private perspective either. So when it comes to fireworks in Canada Day, it's going to be about personal pieces. And there's a couple of, it is allowed. It's actually allowed on Canada Day and or the 2 days immediately before or following the holiday. So you may see it as people determine what the best weather is. So that's our fireworks bylaw. Important to note, you can't let them off in roadways or in parks. So moving into public space and having your own personal fireworks display is not permitted. This is really about small fireworks going off in people's private property in an area. And just please respect the gathering sizes. You can have up to 25 people come over and enjoy that. As the mayor says, keep your distance from one another. And if you can't, wear a mask, and things will go off without a hitch. But in terms of any large scale gatherings for it, they are not allowed. So if we do hear of those or get complaints about people gathering in the public space to light up fireworks, there will be a response from the city of Hamilton, because all of that is not occurring this year.
My only follow-up to Paul would be that last year there was a ban for fireworks in Hamilton. Was there a reason why the city chose not to do that again this year?
The bottom line is we're being encouraged to have outdoor activities, and when you can say to people you can have up to 25 people gather outside with you, it seems at some stage you have to just let people do the right thing. So again, what we did do is we did not permit anybody to do large scale fireworks. So even if you're a private entity or not-for-profit entity, you still would need to apply to the city to have a large firework display. None of that's occurring. The difference this year is that we're in a very different space than we were last summer. If you think about Canada Day last summer, talk of a vaccine was whether we could have a vaccine, not, how the great numbers that Dr. Richardson and the mayor talked about in terms of how we're doing. We're in a different space. The gathering rules are there. And to be honest, we are in this mode now of tipping into, this is about personal accountability and personal risk. And if people do the right things, whether it's with sports or whether it's with fireworks, it'll all go off without a hitch. And This year, we feel we need to just start encouraging that to occur, and people to be safe and do it in the right way. But make no mistake, if there are things happening in our community we need to address in whatever way it is, we will. So it's a different summer. We're in a different place, and I think that's the best reason that I can give in terms of why we said from a personal perspective there seems to be no reason to ban it.
Thank you very much.
Great, thank you, Paul. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks very much for taking my question. This one's for Dr. Richardson. I can't remember if it was Dr. Williams or Dr. Tam, but someone had a great line about the race between vaccines and variants. I know you were asked about the variant and the concerns around that. I'm wondering who's winning in the race against vaccines and variants from your perspective, and do you think we're going to have a fourth wave like they're experiencing in the UK?
Yeah, thanks very much, Matt. That's ultimately going to be what history tells us, of course, about who's won in relation to the variant and the vaccine, and as to whether or not we have a fourth wave, whether or not it's of any significance. You know, the forecasting that we have right now from Scarson shows a small swell happening later on in the summer, which would be due to the Delta variant if those numbers get a hold here. And we're very much hoping that's not the case. That's why we're so focused on our vaccination rates here in Hamilton and getting them up. Just a couple of things to add too, that we did have record high vaccination rates last week with over 8,000 doses that were administered June 23rd, 24th, and 25th. We're sitting at about 2,300 doses a day at First Ontario, 1,600 at St. Joe's, 1,100 at Hamilton Health Sciences, and our new ArcelorMittal Dofasco clinic sitting at 550 doses per day on average. And we hit record highs at First Ontario on the 25th and 26th at 2,550 doses. So we're really doing well in that vaccination race, but ultimately we still rely on everybody, as you heard from the mayor, you've heard from others this over the course of this conference, about the importance of still following things like masking, washing your hands, staying home if you're sick. And those are both the vaccination and following those measures for now are the key ways to win this race.
Thanks very much. And my follow actually is for Paul Johnson. Paul, I'm sure you got a lot of people's hearts beating faster when you talked about live concerts and special events coming back to the city. And I know you probably have to be because you don't know, but you're a little vague on timelines. Can you be a little more precise about when we could potentially be seeing live music back in the city?
Oh, well, just to be clear, at 12:01 a.m. on Wednesday, we could have that. And I have no doubt that in some small settings, people may be wanting to do that. If they're having to apply to the city for a special event permit, I doubt we're going to be turning them around in just a day and a half or something like that for that Wednesday. But in terms of areas where they wouldn't need to apply to the city, and again, this could be music that occurs on patios, live music that occurs on patios, different than the sound system music that I talked about earlier, or small private venues or whatever where they want to have them. As long as they do them under the provincial guidelines with all the safety precautions in place, whether it's distancing from the audience, whether it's the percentage capacity, we could be seeing these things happen. So, you know, I try and be a practical person and say I don't know on Wednesday how much that will be there, but I expect that in certain cases, we'll see some of this happening very quickly. We have performers that want to get out and perform, and I know that we have a lot of Hamiltonians that can't wait to get back to some of those things. It's those things that make it feel a little bit like a normal summer. And I'm really pleased. I'm pleased for that industry that the province has recognized right out of the gate. Let's try and start things slowly and safely. And then you can expect that in step 3, what will happen is those sizes of those that can gather and be spectators for that type of activity may grow depending on how we're doing. So I think you could see some things happening very quickly. Canada Day, maybe, depending on weather and other things. You might see a few things happening in a private perspective. I was just providing a bit of context in terms of city special event permits. If you require one of those, it's going to be pretty hard for us to turn that around in a day and a half.
Thanks very much.
Thanks, Paul. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the question. I hope everyone had a nice weekend. My question is for Dr. Richardson. We're still seeing gaps in vaccination rates among those in the lowest income areas in Hamilton. Do you know why that is, and what is being done to try and fix these gaps that seem to be quite persistent and have been going on for some time now?
Yeah, thanks so much, Joanna. That's the whole health equity piece has been an underlying part of the whole vaccination program, whether you're talking provincially and all the information you've seen the science table produce and the hotspot area designations, both locally and provincially, as well as acceleration of vaccines through those particular areas to try and address those things. The reason for those reduced rates is rooted in the social determinants of health, and so these are long-standing inequities that aren't going to be addressed by the vaccination program alone, and are really bring those to mind for all of us as we go forward as a society and as a community. But we have been out there with special clinics that have been arranged in those areas. A lot of the pop-up clinics, as you know, have been in community centers, rec centers in those areas. We've been working very hard with our partners, with people like Refuge, with Détois de Desnay, with the Hamilton Center for Civic Inclusion, with all sorts of groups to join together and get the word out, make sure that messaging is available to people, that we're not using just electronic platforms, but being in the places where people are and where they gather to provide them with information. And so, we have our vaccine ambassadors who are out, they ask around about where people are likely to be, and they make sure that they are there. They actually have the means to sign people up for vaccine right there and then, whether it's at a clinic that's going on in the neighborhood or anywhere else. Some people would rather go elsewhere to get their vaccinations. So been working at this very hard. It's going to continue to be a focus for us as we go through to get those vaccination rates up right across the city and help people with their questions. We know often they have questions for their family doctors that they want to work through. And so our primary care partners have been a critical part of this as well.
Thanks so much for that. And my second question is also for you, Dr. Richardson. The federal government, there are federal, guidelines now for those who have 2 doses. And I wanted to get your thoughts on those guidelines and if there's any areas of concern for you or any advice you have for people when it comes to those new federal guidelines.
Well, it's great to see the Public Health Agency of Canada getting those together and putting thought to that, and sure that there's been discussion across the country behind those good discussions. But really, those are guidance that needs to be adopted at the provincial level as well as the local level based on the circumstances that we're seeing in each province, in each community as we go forward. And so our provincial counterparts are discussing these same sort of concepts and just how they're going to be applied locally. So it's really important to know. We did hear people over the weekend saying, well, we have the federal guidance now, so doesn't that take precedence? And no, it is the provincial guidance. It is the constraints that you've heard about from Paul in terms of what we're doing, where we're going, and we are still advising everybody to follow public health measures for now as we get through these last stages with the variant and get our vaccination rates up. So I think that's the most important part, is for people to know this is great. This is what we can look forward to if we are vaccinated, but we still have a little ways to go before we're fully at that point.
Thank you, Dr. Richardson. So we have a bit more time, so we'll go through for one more question each. We'll go back first to Christine Rankin from CBC Hamilton. Christine, if you'd like another question, you can go ahead.
Sure, absolutely. Thanks for the extra question. And I believe this will be for Dr. Richardson. And I know a couple months ago, some studies were suggesting that there were benefits in delaying a second dose of, I believe, the mRNA vaccines. And I know some people are really focused on bumping up their appointments, but confused if something could be too soon. So I'm just wondering what message you have for people who are stressed and just want to do the right thing for their health.
Thanks, Christine. It's been such an interesting time in terms of information coming out, and it does change over time as we learn more. We're very much putting in place the science that we're learning as we go. And so information does change as more science comes out and comes available to us. So the spacing of second doses, we know from the initial studies with Pfizer and Moderna, those were ideally at the 28-day mark, it was felt. There's still some good immunology in general that shows that waiting could give you a slightly better bump up in terms of your immune status. But remember, we're also thinking about the variants that are circulating and wanting to make sure we have maximum protection in that kind of environment. So as we saw Alpha with the second wave and into the third, and now the Delta variant has emerged, we are encouraging people to get their second doses as early as they're eligible to do so. all through this, of course, we've also been balancing that with making sure everybody gets a first dose as well. So that's been a balancing act to go through. Now, remember though, for those who had AstraZeneca vaccine, that is where a longer interval is recommended for that same principle in immunology, where we do see from the studies with that vaccine that if you wait a little bit longer, you do get a better bump up in immune response, and it's presumed that'll happen when you get an mRNA vaccine as well. So for those who had AstraZeneca, that's where the guidance is getting vaccinated, somewhere in that 8 to 12 week window. So I hope that helps, Christine.
Great, thank you, Dr. Richardson. We'll go back to Bobby from CBC Hamilton. Bobby, if you'd like another question, you can go ahead.
I'd love another question. Thank you. Dr. Richardson, this, dying after 2 doses of a COVID-19 vaccine does seem to be really rare. And I just wonder, I guess right now it's the only one in Hamilton. So I'm wondering, what would you say to people who are listening and watching and reading? Is there anything that they could do to try to mitigate this? Any sort of key message you want to get across to them?
Thanks, Bobby. I think there's a couple of things. We do know that we had some concerns with the AstraZeneca vaccine, and so we did see a syndrome afterwards, that people were advised about the symptoms related to it and to watch for those and to seek some care if they had it, and to mention that they've had the vaccine. So I think that's the one instance where we know there was a particular side effect that was of concern. You've also been advised, if you're having a vaccine, you'll see other recommendations about hives or difficulty breathing and those sorts of things. So paying a good attention to anything that's a serious side effect is, of course, a very important thing to do after any vaccine, after any medication that you take, and making sure to seek care in a timely way if that happens to you. But most importantly, I think, is to remember that these are very, very rare events that happen. Oftentimes it's related to some other illness that an individual already has. And so what is so very, very important is that really these vaccines are way, way better in terms of preventing hospitalizations, preventing severe illness, preventing deaths that are related to COVID-19 than any of the side effects that we might see. And so the benefits of these vaccines far, far outweigh the risks.
Thank you, Dr. Richardson. We'll go back to Jessica Maxwell from CBC Hamilton. Jessica, if you'd like another question, you can go ahead.
Thank you very much. This question's for Paul Johnson. So people are definitely looking forward to seeing friends, family, and get away locally this summer. Are you expecting any kind of tourism, and are there plans to contend with that?
So certainly as the summer goes on and restrictions continue to be lifted, there will be more movement. And, at some point, I don't know when it'll happen, but at some point there will also be, lessening of restrictions at the border. We know that's going to occur. So yeah, people will be moving around. And I think, for me, the pieces are to, listening to Dr. Richardson and the public health folks, it's really, you have to take into account your own risk, both tolerance, but your own risk factors, because we're all different. And then the second piece is, follow what are fairly basic rules. And there are lots of things that we can do. And you just need to understand the higher risks and the lower risks. But our hope is that people will appropriately travel when they can. And we need to get back into that business. And we can't be afraid of that business forever. But it is about this slow, measured progress towards it. And I think that that's going to be the story through the summer, is that it will continue to build, and then into the fall, and then into next year. And in terms of encouraging it or managing it, I think Hamilton will be part of that, tourism and the part of the movement of people, as we always have been, particularly nestled between Niagara and Toronto. We're a destination in and of itself, but we're also a destination for people who are coming to the Greater Toronto and Niagara area and Hamilton area. And the message just becomes, let's be safe, do things wisely. And before you set out to do anything this summer or at any time, just think through the risk and take the appropriate precautions and recognize it will be different for other folks. The last thing I'll say is that at times people want the answer. Do this, don't do this. And what we're going to see in life with COVID-19 is that it's going to be nearly impossible to say, do this, don't do this as absolutes. It will be about thinking about those risks, thinking about your own health and your own comfort level with things, and then making the appropriate decisions. But the good news is that all the advice you need in terms of how to do most things in a safe manner are available. And that would apply to travel as people start to move around, both in the province, and I expect we'll see people coming from outside the province fairly in short order as the summer goes on as well. So it's really going to be about making sure you get vaccinated. That's a first step along the way, and then assessing risk. And for those that are proprietors of the business, follow the rules and make sure that you're following the rules. And then I think we can handle most of what will come our way. And make no mistake, if Dr. Richardson sees anything that's heading in a direction that needs to be addressed, we'd have those conversations quickly as well. But I know that her and I talk often about we have to get people back to doing some activities and do the safe activities, do the activities that can work. And some of that is going to be moving around the province as the summer progresses.
Great, thank you, Paul. We'll go back to Matt Ingram from CHCH. Matt, if you'd like another question, you can go ahead.
Thanks very much. I think this question is for Paul. Last week, the CFL announced that they're doing a season, which delighted a lot of people. And we're going to have a Grey Cup in this town come December. I'm wondering, I know it's only been a week, but what stage of preparation, thinking, planning has City of Hamilton been engaged with the Ticats in terms of getting ready for home games and having potentially people from all across the country coming to our city in December?
So I'll tackle the first piece first. We're not quite there yet in terms of Grey Cup planning, but we did have an initial conversation with the Ticats, and we can't forget our Canadian Premier League team, FC Forge, who will actually be a team that will be participating in live sports with spectator audience prior to even the Ticats. So we've been talking to their representatives, and they're going to build a plan as they have throughout and present the city with a plan. It'll be reviewed by public health. It may have some review by the Emergency Operations Center, but it's really more about public health being satisfied with the things they're doing. But recognize the CFL has tons of protocols. They're doing this in every CFL city across the country. There's obviously multiple teams, 3 of them in the province of Ontario, that need to go through this. So they'll be doing things in concert. So we started that conversation late last week, encouraged the Forge and Ticats to develop the plans that they, as they see the regulations and as they've been in contact with their governing bodies, and then they'll present those to us. And they've done that throughout the pandemic. It's been done extremely well. And I know that both from a public health perspective and an EOC perspective, we've been very pleased with the level and the detail of their thinking. They aren't just saying, hey, how do we just get back to business? They care about the safety of obviously of their players and their staff, but they care about the safety of the spectators. But I will tell you, there was a few more smiles on the call that we had late last week about the prospect of having people actually witness these games and be part of this activity, and that slow progress to getting back to, again, some of those more normal activities. And the excitement of the Grey Cup is obviously palpable in this town as well. So we'll continue to work. Initial conversations have started. There are no games obviously happening imminently, which gives them time to pull together a robust plan and gives the city time to reflect on that and to make sure it's the right kind of plan, because there's obviously going to be limitations in the number of people who can attend Tim Hortons Field. And then there's also the issue of ingress and egress out of in and out of the stadium, but also when people are in the stadium, what they can and cannot do in terms of accessing indoor space. So lots of things for them to work through from the fan perspective, and lots of things for them to work through from their team perspective. And we'll be with them every step of the way. But it was nice to see some smiles and some planning on that front as well.
Thanks very much.
Thanks, Paul. We'll go last to Joanna from the Hamilton Spectator. Joanna, if you'd like another question, you can go ahead.
Thanks so much for the extra question. My question's for Dr. Richardson. There have been some reports in other cities of vaccination rates flattening or starting to flatten a bit earlier for younger people, so those in their 20s, maybe late teens. Are we seeing any trends like that here in Hamilton? Do you know why? Is there anything you can do about that?
Thanks very much, Joanna. You know, what we've seen across the board in all of our age groups is that first sort of 40 to 50% of people get vaccinated very quickly. And then there is a slower rise that slows down a little bit over time as we go forward. And so we've seen that as well with our youth. We're up at 58%, which is just great in terms of our vaccination coverage so far after not quite a month of, or just about a month of offering vaccines to this group. So we'll continue to work with the community to look at, you know, what are the reasons why people may not be getting vaccinated. As we've heard earlier, a lot of this is rooted in the social determinants of health for many, many people. And so we are looking at those issues. We've had, again, pop-up clinics in different places. We have people out with our youth. There's a focus with our youth in terms of signing people up through the schools as they go and do pickup for their supplies, particularly in areas with lower coverage rates. And so we'll be using many of those similar tactics to what we've used before. We've been meeting too with our Children's Hospital. You know, they've been a huge part, McMaster Children's, of our campaign around youth, helping particularly for kids who may have a little bit of anxiety around having needles or a little worry about the pain. And as well, of course, for our youth that have special needs. And so we'll continue to work with them in terms of getting the message out and getting those vaccination rates up as high as we possibly can.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I'll pass things back to you.
Great. Thank you, Jasmine. And thank you, Bill Custers and the entire team at Cable 14 and Clear Cable. All of you have done this about 100 times collectively, and it has been a smooth broadcast all the way through. We thank you for that great effort. And of course, thank you to our media partners who have turned up about 100 times to share this information with our broader community to make sure that we keep them informed as the best degree possible. So thank you for all that effort. If you want more information on COVID-19, financial supports, or any other updates, visit our website at hamilton.ca/coronavirus. And please continue to follow all those public health measures and do book your appointment as soon as you're eligible to do so. You might have to exercise some patience every time we open up a new booking regime. There's a big crush on the system, but bear with it, and you will get your appointment ultimately. And again, the vaccination process has been absolutely sterling. Once you get into the vaccination centers, the staff there are doing a terrific job of making sure people are treated nicely, and you know, the anxiety is taken away to the best degree possible, and very efficiently vaccinated in and out fairly quickly. Summer is upon us, and you know, we know that there are some changes over the summer, so we're going to be moving our media appointments to bi-weekly, so every 2 weeks over the summer months, starting on Monday at 3 p.m. throughout the summer. So residents can't find any additional information on the city's website at hamilton.ca/coronavirus. All of the information around coronavirus and all the supports that are out there in terms of folks that are still underemployed or unemployed, or businesses that are struggling, those resources are still out there. So please access those resources as much as you can. And let me also thank all the great communication staff and public health associated with the EOC, all of those that are put their mind to ensuring that these media briefings go smoothly, including staff in my office, Michelle Shantz, who has now moved on to communications in another division of the city of Hamilton, and Gemma Spadafora, that has taken over to make sure that these notes and materials that we deliver to you are effective and clear, and that we can continue to share that information with you on an ongoing basis. So come Monday, July the 12th will be our next media briefing. That's 2 weeks from now, so July the 12th at 3 p.m. In the meantime, enjoy the great outdoors, enjoy the great weather, and take care of one another. Do follow the public health advice to the best degree possible, and we will see you in a couple of weeks. Thank you.